Questions, questions, questions. Health 2.0 is over, and we have so much to talk about on this episode of Health in 2.0. Mr. Holt, do you have your timer? We just jump into this because
How many questions? You've got like hundreds of questions. We're gonna have to be fit and ready and go. When we just did Health 2.0, I was at Rock Health. You're gonna go to Serendipity. Even Serendipity. There's all this going on, and yet people there's a fire hose of news.
I'm going to Barcelona too, and then Berlin after that. Everybody needs to hop on a plane and come with me.
All right, we don't have time for any of that because we're gonna get right in. You ready?
Fine. Here we go. Start it. Amazon Care.
Amazon Care. Okay, so they are doing telehealth, house calls, I think urgent care, and drug delivery, maybe with drones, all at once, all wrapped around for their employees. Don't forget, this is how Kaiser Permanente started with stuff for their employees. Probably going to be a big deal.
Okay.
Walmart's doing something too on location with mental health and other stuff. It's going to change health delivery, probably.
Yep, non-healthcare gets in healthcare. Okay, Echo raises $20 million. What is Echo?
Smart stethoscope that has picks up EKG, ECG, the one in your heart or the one in your head, and does all kinds of stuff. Has lots of recordings of AI and stuff. Sorry, recordings of hearts, EKG strips and whatever, and theoretically can tell you've got a heart murmur and you're going to live or die.
Okay, Bayer released around $40 million for OneDrop. What is this?
Don't quite understand what Bayer's doing in there. I think it was in diabetes, but anyway, they have a blood glucose meter and intelligent stuff coming out the back end. Maybe they're late because Livongo and Armada seem to be ahead of them.
Okay, GoodRx buys a telehealth company. Hey, doctor.
Yes, and they could have bought Hello Doctor, which is out of business, or Hello MD, which is the marijuana expensive one. But they're basically going after the telehealth market for Ro, Lemonade, Hims, all those guys. Cheap telehealth online. And I guess they'll be diverting it and making money off their coupons.
All right, Rock Health invests in a couple companies, $10 million for Inside RX, and then an undisclosed amount for a company called Arene, which is secret.
All right. Inside RX, I think it's something to do with precision medicine at the bedside. I didn't really get what that was. Arene, I had a really good attempt to look at when I was at the conference because they're similar to Surveyor Health, the company I know well. They didn't really tell me what the hell they were doing. They said they built it in 2 years. It seemed to be everything to everybody, maybe.
Okay. Peloton IPOs today. Everybody's looking at this as a healthcare company.
No, it's not.
Okay. How about...
Oh, you just got it in.
Oh my God, we're ending with gossip. Dirty gossip scandal.
Oh, go on.
Coming out of North Carolina, Blue Cross Blue Shield of North Carolina CEO Patrick Conway getting arrested for a really bad drunk driving.
Yeah, no, this is not, look, this is a sad and bad story. Conway has been one of the good guys came from Medicare Innovation. Obviously had a big substance abuse problem, and it was 3 in the afternoon, got caught in a drunk driving accident, kids in the car and all that stuff. There's two things on here. One is the board tried to kind of brush under the carpet. He went and did he actually has written saying that he's now done this, the sort of addiction program, and he's been sober for 90 days, and he wanted to keep going. They'd kind of hidden a bunch of the stuff about the arrest, and there was some pretty bad stuff. He, threatened the cops and, was rowdy in the jail and stuff. He wasn't a well-behaved drunk driver. And so he was actually forced to quit. And what happened is that the Cambia folks who were doing a merger, remember that? We talked about this. We don't understand what it was about a year ago. They're kind of backing off that now while they figure out, well, why didn't the board tell us what they knew? Why didn't the North Carolina board tell us what they knew? And, it's actually a very sad story because, luckily no one got hurt. But clearly not a good thing, and we got, and who knows what pressure he was under, et cetera, et cetera. However, you can't do that kind of stuff. So
so tragic, though, too. So tragic. And Ooh, terrible. Way to end on a high note there.
No, we didn't end on the sad thing, but we got through a lot of those quick ones.
Being sarcastic.
But don't we? I did it fast, and don't worry. And we finally understood how Amazon is going to take over the world. Maybe. I wonder why Google hasn't done anything yet.
Oh, maybe next week.
Well, look, you think about the pieces they're putting together in care delivery and all the pieces people they hang out with, the Heels, the Livongos, all those companies in the world that we know about who are doing lots of different pieces you need to do. They're all starting with sort of, general primary care, but then they've got to move into chronic care. Amazon's got all the pieces. They have that thing called Haven, you may remember.
Yes,
which is
not
part of this
announcement. What happened to them?
Well, why isn't that doing? I actually had a quick chat with one of the other people I know, and they went, "Well, we compete internally, So,
do we?
There's a lot. Look, healthcare provider side delivery is going to be changing. You may remember our buddy Jonathan Bush at Health 2.0 said, even if the 8 well-funded primary care groups all do as well as they possibly can, there'll only be about 10-20% of the market for primary care. One gives the impression if Amazon does as well as it can, it might be more than 10% of the market for primary care if they continue to go down that path. But it looks like they could.
Unbelievable. It's such exciting stuff happening.
Oh, it's all exciting. It's as good as getting Best Buy to deliver your washing machine, which still hasn't bloody happened yet.
Okay, so I tweeted out, just as an aside, I tweeted out about this whole Amazon Care thing and Walmart from like 2 weeks ago, and it's like the non-healthcare companies are getting into healthcare, and the number of people who were like, Jess, you forgot about Best Buy, and I'm like, I did not forget about Best Buy. You need to read Matthew Holt's op-ed about Best Buy and how this is not consumerism appropriate for healthcare.
Five deliveries later, still
nobody wants to hear this.
Still no washing machine. Go to the website. I'll have to read. I'm back there Monday, hoping they finally show up.
Check your timer, friend. You're out of time. Nobody wants to hear this story. But if you do want to follow along, God help you and God bless you. You can go look at this man's Twitter feed. And if you can't find it there, just search Best Buy on the healthcare blog and you can read all about it. And all the tweets are embedded. So if you haven't run into Matthew Holt in 2 weeks, you too can catch up with the drama about his washer and dryer.
And its impact on healthcare.
How many times has this girl had to hear it? Thank God I'm leaving the country. Okay. On that note, if you want to follow along with where I'm headed, I'm at Jess Tomasa on Twitter. I'm going to Barcelona's Health Hubs launch next week, and then Bayer's signing day the week after. And then if you want to find out about washers and dryers, of course, there's Apple.
I'll also be popping the Tech Crunch next week in San Francisco, not as glamorous as Barcelona, but what can you do?
Well,
and we'll do one from other parts of the globe.
Yes.
When you my favorite kind of Health in 2.0, Jess, when you're a long way away from me.
Oh, my favorites are the ones where I get takeover episodes and you're not even there.
You win.
Sorry. All right, guys, thanks for watching. Follow along with us on YouTube at Health in 2.0 or subscribe to the Healthcare Blogs newsletter. Just go to thehealthcareblog.com. Thanks a lot for watching. We'll see you soon.